Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about diseases of pharynx, salivary glands, and oesophagus. Common symptoms of conditions that affect the pharynx. Many conditions may affect your pharynx, causing different symptoms. Some conditions are more serious than others. For example, having a sore throat doesn't mean you have throat cancer. That said, you should talk to a healthcare provider if you have symptoms that don't go away or keep coming back. Common symptoms include a sore throat that doesn't go away after a few days, troubling swallowing, earache, fever higher than 103 degrees Fahrenheit, which could be a sign of infection. Lumps in the back of your neck feeling weak or stiff. Now, further about disease of salivary glands. Mumps. This is an acute inflammatory conditions of the salivary glands, especially the parotids. It is caused by the mumps viruses, one of the parainfluenza group. Next one, tumors of the salivary glands. Salivary adenoma. This begins tumor occurs mainly in the parotid gland and is the most common tumor of the salivary glands. A second tumor may be developed in the same gland several years after the first has been removed, and it occasionally undergoes malignant change. Carcinoma. Malignant tumors most commonly affect the parotid glands. Some forms have a tendency of infiltrate nerves and the surrounding tissues, causing severe pain. Lymph spread is to the cervical nodes. Disease of oesophagus, esophageal varices. In conditions such as cirrhosis, a venous thrombosis, blood flow into the liver via the portal vein is impeded and blood pressure within the portal system rises. This forces blood from the portal vein into anastomotic veins, which direct shunt blood into the systemic venous circulations, bypassing the liver. 50% or more of the portal blood may be shunted into anastomatic veins, leading to rising pressure in these veins too. Tumors of the oesophagus. Begins tumors are rare, accounting for only 5% of the oesophageal tumors. Malignant tumors. These occurs more often in males than females. They are most common in the lower esophagus but can arise at any level. Both types of tumors described is important. Now, let us discuss further detail about salivary glands, esophagus, and pharynx diseases. Disease of the pharynx. Disease of the pharynx include pharyngitis, that is a sore throat, infectious like strep throat, viral illness such as the flu and mononucleosis, and other conditions like GERD, allergies, and potentially more serious issues like cancer or deep neck infections. Other pharyngeal issues can include tonsillitis, throat cancer, and difficulty swallowing, that is dysphagia. Next one, disease of salivary glands. Salivary gland disease include a variety of conditions that cause symptoms like a dry mouth, pain, and swelling. Common causes include infections, that is, sialadenitis, salivary stones, sialothiasis, autoimmune disorders such as Sjogren syndrome, and tumors. Treatment varies depending on the conditions and can involve antibiotics, removing obstructions, managing symptoms with saliva substitutes, or surgery. Next one, disease of oesophagus. Common, common esophageal disease include gastroesophageal reflux diseases, GERD, which involves stomach acid backing up into the esophagus, and achalasia, where the lower esophageal sphincter doesn't relax. Other conditions include Barrett's esophagus, eosinophilic esophagitis, esophageal strictures, that is narrowing, and hiatal hernias. Less common issues include esophageal diverticular, esophageal cancer, and infectious esophagitis. So far, we discussed little about disease of pharynx, salivary glands, and oesophagus. We have done. Please subscribe our YouTube channel.